Hi, before we start this ASMR video, I'd like to thank all these members on my Patreon for their continued support. If you're looking for any content that I create on other platforms, check the link below. Now, let's get into the video. Thanks for coming in for your cranial nerve exam. Before we begin, there's a couple questions that I need to ask you. I need to make sure that, obviously, I have the right patient. The last thing you want to do is have a malpractice where you're divulging information of other patients to another patient. Firstly, let's start with your name. It's a beautiful name. Last name, please. Perfect. Just inputting some of that information up here. There's a chart just above your head. I always keep hard notes, though, as well. Your height. Do you know your height? Weight. Your weight is it's private and confidential. Anything you tell me, don't worry. Doing well, I see. That's awesome. Any recent medical histories that I should know about other than what's on your file here? No, okay. Good. Any new medications? Anything else that I should know? Perfect. Shall we begin the exam? We've done this cranial nerve exam. I think it's every 3 months, quarterly, that we go over this just to make sure that all your neurological symptoms or lack of symptoms are in check. I'll be going through a variety of exercises, and I think you know the drill. Let's get a pen that works. Pen light. Perfect. I'm going to look into your eyes first. You're going to look up, down, side to side. Perfect. So I'm just going to come into your eyes now. Okay. Good. Can you look down? That's great. Just going to move your eyelid there. Up again. Let's look at the other eye. Good. And the other one. Good. When you look at me, just look to the left, please. Yeah, that way. Just follow. Good. And then take this finger. Follow to the right. Good. Okay, now just follow the pen light. The light here, just follow that light. Just keep your eyes on the light. Keep your eyes on the light. Good. Any issues with that? Any double vision? Perfect. Was it blurry, or could you see it quite clearly? It's a mouthful. Good. No issues. I like that. Perfect. Just stick your tongue out for me, please. I'm just going to grab your tongue. Good. Can you move your tongue to the left? To the right? Good. Stick your tongue on the top of your mouth. Top of your mouth of your roof. Good. Stick your tongue and go, ah. Good. Your mouth looks healthy. I'm no dentist, but your teeth look pretty nice as well. Eyes are good so far. Let's continue the eye exam. These are cranial nerves 1, 2, 3, and 4 that we're going through. When I cover this eye, can you still see me? Good. This eye. When I cover your eye, can you still see me? Good. When I cover both eyes, is it black? Good. I've got an instrument here. There are holes in it. When I look it over, can you still see me? Can you see any outline of me at all? Anything? You good? Great. Now, when I move this tool close to far, am I still in focus? Good. Other eye. Perfect. Now, when I've got this in front, can you see the black dot here? Good. As it gets closer, does it fill your vision? Good. And as it goes backwards, same thing. Perfect. I'm just going to take my measurements here. Just need to make sure distance between each pupil is still good. Just give me a second here. Okay, so we're starting at 1 to 5. Good. Let me see my previous measurements. 5. No change. That's good. What's that? I'm just looking at the distance between each of your pupils. Sometimes, if there's issues happening in cranial nerves that I can't see, your eyes may start to look in opposite directions of each other. No, that's not a good thing. But thank you for asking. Perfect. I'm just going to come into your eyes one more time. Just let me look here. Tell me when the light is on and it's off. Great. How many times did I turn that light on and off? Good. You had to think there a little, didn't you? Now that we've finished your eyes, we're going to work on other cranial nerves, 5, 6, 7, 8, all the way up to cranial nerve number 12. Cranial nerves 5, 6, and 7, I'm going to test your ability for your muscles to react in both a flexion and a pushing position. It's one of those days I need to have more coffee. My tongue is quite tied. What I'd like you to do is I'd like you to put your arms up like this, please. Each arm up like this. And then I would like you to, as I pull your arms backwards, I'd like you to resist. You got it? Good. Please put your arms up, your palms facing yourself. As I pull back, I will be stating resist, resist, resist. In which case, you will then be trying to resist me pushing it. Almost like you could punch yourself in the face, but please don't pull that hard. Alright, arms up for me, good. And resist, resist. I'm pulling. This is where you resist. Resist, 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 resist. Excellent. No issues there. Lots of motor functions in your muscles. We're going to do the same test, except instead of you resisting and pulling towards yourself, you're going to be pushing away. Still, palms are going to be facing you, though. I'm going to be pulling away, pushing instead. So, arms up, please. I'm going to be pushing into your palms here. And resist, 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 resist. Excellent. Cranial nerves 5 and 6. No issues there. I should be writing this down. I've got sort of and 6. 7 and 8 are your shoulders, where I'm going to be pushing down on your shoulders. Quite similar to the pulling and pushing of your muscles, except you're going to be resisting in terms of me pushing your shoulders down, and then I'm going to be pushing on your hands, and you're going to resist me pushing up. Got it? Good. Actually, another way, I'll show you as we do. For now, I would like your shoulders to be up high like this, please. That's right, lift your shoulders. I'm going to be putting my hands on either side, like so, and I'm going to be pushing in a downward motion. You are going to resist me pushing down. Does that sound good? Yes, this is cranial nerve number 7 that I'm looking at. So, shoulders up for me. And resist, 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 resist. Good, good. You can stop resisting now. Excellent motor function there. Now, what I'm going to be doing is I'm going to be hands by your side. I'm going to be putting my hands underneath your palm, and I'm going to push up on your palm. I'm trying to push your shoulders up. Your objective is to not let me push your shoulders or your trapezius muscles up. Good. Good. Hands by your side. And here we go. And resist, resist, resist. Don't let me push those shoulders up. Resist, resist, resist. You can stop resisting now. Let's write that down. Cranial nerves 7 intact. Flexion and dorsiflexion, good. Shoulders equal, both left and right. Excellent. I'm just going to be listening in at your heartbeat now. It's not part of the cranial nerves, but I figure it's always good to check on my patients' hearts. Make sure that they're working appropriately. I'll be doing a couple sequences here where I listen to your heart and then I get you to do a series of breathing techniques. Good. Good. Alright. It's not that cold, trust me. Let's warm it up. Good, just going to put that on your skin there. Nice, steady heart rate. Now, I'm going to get you to take a series of breaths. I'd like for you to just breathe normally. Okay? Breathe in. Good. And out. Breathe in. And out. Breathe in. And out. Breathe in. And out. I'm going to just do your backside now. Breathe in. Breathe out. Breathe in. Breathe out. Good. Breathe in. And breathe out. Breathe in. And breathe out. I'm going to put this on the back, top portion of the back. I'd like you to say the word 99, please. Go ahead. Yes, say 99. Good. Other side now. Same thing. Say 99. Good. Final one. I think I'm just going to get you to cough for me twice. Just a little. Go ahead and cough. And go ahead and cough. Perfect. No issues there. Your lungs don't sound like they're straining by any means, and your heart sounds perfect. Now I'm going to be doing cranial nerves 8 and 9. 7 and 8, sorry, 9 and 10. Sometimes there's so many I get screwed up. This is just checking functions of your face. Can you smile, frown, furrow your brow, move your ears, all that type of stuff. So I'd like for you to keep your eyes closed, please. Good. And I'm just going to try and lift your eyebrows up here. Sorry, your eyelids resist me pulling your eyes open. Good, good. Good. Can you blink twice for me? Just like that. Follow along. Good. I'm just going to get you to make sure that comes into your field of vision, just look at it. Good. 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 Great. Good. 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 Any issues there in terms of following it? Good. Just follow my finger. Follow that finger. Good. I'm going to touch your nose. I'd like for you to touch your nose and then touch my finger as I move it around. So, hand on your nose, please. Good. And touch my finger. Touch your nose. 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 Good. Motor skills intact. So we've gone through cranial nerves 1, 2, 3, 4, 5, 6, 7, 8, and 9. Let's write that down. I know I have a photographic memory, but not everybody does. So cranial nerve 8, 9, motor skills intact. Lungs also good. Heart steady. Perfect. So we've got just 10, 11, and 12 cranial nerves to do. These ones are pretty straightforward. Could you smile for me? Just give me the biggest smile you can. Good. Can you blow your cheeks out like this? Good. Good. Can you make sure, hold that breath or that air when your cheeks are expanded? I'm just going to try and push it out like this. Don't let me do that. Good. So that was cranial nerves 10. Number 11, I'm going to be just creating a little noise by your ears. Nothing loud, nothing to hurt you. I'm just going to come to your left and then your right, okay? Good. So, tell me if you can hear this. And can you hear this? Good. Can you hear when I come into your right eye? Your right ear? Does it come closer to you? And your left ear? Good. I'm going to come into both your ears at the same time here. Good. You can hear each of those ears. You could tell the depth perception of it coming closer and farther to you. Good. Now, in general, can you just hear this? In both your ears. Good. Is either ear more loud than the other? No. Good. That was cranial nerves 11. We'll get to the final one in a second here. So, 11. Ear mobility and hearing senses intact. No issues found. The final one, cranial nerve 12, your memory. I'm just going to give you a sequence of things and I'd like you to repeat back those sentences to me. Peter Piper picked a pair of pickled peppers. Good. What was the first word in that sentence? Excellent. What was the last word in that sentence? Perfect. Excellent. Now, how old are you? Do you know what day it is? Do you know what city you live in? What color are my eyes? Good. Good. Am I wearing glasses? Excellent. And what is 2 plus 2? Perfect. Seems like all your nerves are intact. Cranial nerve 12. issues. Seems like you're in good health, my friend. Margaret will see you at the front there. No need to pay. This one's just on us tonight. All Margaret wants is a comment and a like, so... Oh, and she really likes when you subscribe to our office. More clients makes her happier, so we'll see you in